Namaste, welcome back to our channel. My dear student, today I am going to discuss about the second stage of labor and its management. My dear student, it is one of the interesting and very important topic under the obstetrical gynecology and midwifery. My dear students, let us know what is the meaning of second stage here. As I told you in the previous sessions, the second stage of labor is starting with the complete dilatation of the cervix, whereas and it ends with complete expulsion of the fetus. So complete delivery of the baby will be occurred at the second stage of labor only. So this is about the second stage of. Whereas during the second stage of labor, being the medical practitioner, being the nurse, we must do lot of the management here. So what is the management principles? The first principle is to assist the natural expulsion of the baby. As we know that, so NVD, nothing but normal vaginal delivery, is a absolutely natural delivery. For every woman is expecting, and every medical practitioner is expecting to conduct the natural delivery only. Absolutely, that is our principle. And next one is to prevent the mother perineal injuries. Yeah, so these are the two kinds of the principles for the management of second stage of delivery. And next one is general measures. So what kind of the things we make sure while we are doing the second stage of management in the labor. The first one is patient must be on the table, on the bed. So constant supervision we must do, and to administer the some kind of analgesics as well as vaginal examination also. So as I told you, the first one is a preparation for the delivery. In complete setup for the second stage of delivery, the main important is you must prepare for the delivery for the mother. Make sure that the first one is the positioning. So position is a very important. Mostly, so we are using the lithotomy position, as I can show in the diagram. So lithotomy position is a accessible position. It is a suitable position for conducting of the delivery. So this is the first thing we must be prepared for the delivery. And second one is so obstetrician scrub. So we must go for sterile technique. So what kind of the sterile technique? You must wear the gown and mask and gloves, whatever it may be. We have obstetrical sterile technique during the second stage of labor. Make sure all those things are ready or not. And next one is voiding the urine and the bowel and bladder pattern. We must check it, and we must go for placing of the sterile sheet, as I can show in the diagram. So how we can place the sheet and all. So this is the how the sterile sheet we must put the surrounding of the vagina opening. So that is the one of the sterile technique. And next one is 3 C's we need to maintain. The first C is telling clean the hands, as we know the surgical hand washing, and clean the surface where the place of this delivery, and clean cutting while we're cutting the umbilical cord or once the delivery is done. So this kind of the 3 C's are very important for during the second stage of delivery. As you can see in the diagrammatically, so maintain the aseptic technique. So do for the surgical hand washing and go for wearing of surgical gloves. So this is called as maintaining of aseptic technique. And next one is positioning for the delivery. As we know that for every mother, this is a suitable position for the delivery. Its position is called as lithotomy position. Yeah. And next one is a perineal cleaning. So perineal cleaning, actually, so this is how the direction I have shown here. Like that, you need to go for cleaning with antiseptic solutions. Clean the according to the directions. So this is how the cleaning process will be done. So circular motion we must go for. As we know that the cleaning must be from high contamination to less contamination. So this is the place how the cleaning of the perineal area. And next one is how the placing of the sterile cloth. So this is how the placing of the sterile cloth once the mother is getting ready for the delivery. So this is the how we are placing. And next, the important thing is episiotomy. So once the contraction relaxation going to start for the mother through the muscles of the uterus, so definitely the baby is trying to pull out. In that case, we need to do one kind of the procedure. It is a minor surgery, is nothing but episiotomy. So episiotomy is nothing but once you are seeing the crowning, once you are going to find out the head of the baby, you must go for the surgical incision of the wall of the vagina. You can see this is the wall of the vagina. Why we are doing the episiotomy? This is the main important thing. Actually, this vaginal os is about 3 to 4 centimeters, as we know that. But in the case of the head circumference of the baby, about 33 to 35 circumference will be there. In that case, so this must be done, that is called as mediolateral episiotomy. As we are seeing, mediolateral episiotomy, this is how the place we are incising with scissor. So that is the one of the small minor surgery, is nothing but mediolateral episiotomy surgery. It is done in the second stage of labor in the case of delivery only. So this is actual thing. And next one is, the once we are doing the episiotomy, the continuous thing is delivery of the head. So this is how we are going to deliver the head. So that is a delivery of the head will be done by the contraction relaxation of the muscle of the uterus, as well as we are complete continuous administration of this oxygen drip, whereas the done after the episiotomy, then only the head will be expelled. So this is the actual delivery of the head. So once the delivery of the head is done, so soon immediately you must do one procedure, that is nothing but suctioning. With help of suction, so with the help of suction, you must go for do this process. Why we are doing the suction immediately? So soon of the delivery, so the lungs is going to start. So once the lungs is going to start the functioning, then automatically we must go for airway. Make sure the airway is clear or not, because once the baby is within the mother womb, the baby used to drink the amniotic fluid. In that case, the airway is clear with amniotic fluid. So once the delivery is occur, once the baby of the head is expelled, in that case the first thing is suction we must do with the help of suctioning machine, in order to ensuring of the airway for the functioning of proper cardiopulmonary function. So that is the suctioning of the baby. So next one is, once the baby head is expelled, the second one is to ensure the whether the cord is surrounding of the head or not. If it is not surrounding of the head, it doesn't matter, it's not any kind of the problem. So that's what, ensure the cord is not surrounded the fetal head. So if it is not surrounded the cord, umbilical cord, doesn't matter, it is okay. And next one is, once the head is delivered, the second thing is you must deliver the posterior shoulder. So how I am showing the diagram, so this is the how you must go for deliver the baby. And the next one is baby the delivery. So once the shoulder is delivered, next thing is complete baby you must deliver slowly. So once the baby is delivered, the thing is you must remember, place the baby on chest of the mother. So for this is the very important to prevent the hypothermia. This is the very important to maintaining the bond in between the baby to mother. So this is actual thing you must do once the baby is expelled, once the baby is delivered. And next very important is, so once the contacted with the mother, then you need to go for clamping of the umbilical cord. So how the clamping of the umbilical cord? You must clamp, the two clamps you must be placed for the umbilical cord. One clamp must be, so this is actual placenta and this is the delivery of the baby. So 5 centimeters from the clamp from the placenta, and from the baby you can go for 5 centimeters. So in between you can go for cut it. So this is how the clamping procedure and how the cutting of the umbilical cord. So how I am showing diagram. So this is how the clamping of the umbilical cord, whereas we are going to clamp here also in order to prevention of RH inhabitability. So that session I will going to discuss in soon. So in order to prevention of RH inhabitability, so we must cut the umbilical cord here. So that is the one of the important. And next one is umbilical cord is going to, done the cutting section. And next is the immediate care of the newborn baby. So once the baby is delivered, as a nurse practitioner, what is the responsibility of immediate care? The first one is place the baby on the tray. Yeah, absolutely, you must place the baby on sterile tray. Yeah. Next one is cover the baby with the clean and dry linen. So make sure that cover the baby to prevention of the hypothermia and to prevention of the infection for the baby. Make sure that cover the baby with a dry linen as well as sterile linen also. And next one is maintain the hypothermia. Thermal regulation is nothing but absolutely you must go for prevention of hypothermia. And next one is suction for the airway clearance. You can go for suctioning for the baby to prevention of birth asphyxia. And next one is maintain the cardiopulmonary, in the sense lungs plus heart, whether it is working properly or not, that you need to make sure. And next one is if it is needed, then you can go for oxygen administration. So these are the few things you must go for it. And this is the score is belongs to the how to assessment of the baby after delivery, whether it's the baby is normal or abnormal. That the score is called as Upar score. So this is a categories wise. We can see here. The first one is heart rate. So soon of the delivery. So if the heart rate is not there, then the score will be the 0. If the heart rate is less than 100, then you can give the score 1. If the heart rate is more than 100, then the score will be 2. In the sense, the baby is normal absolutely. And next one is respiration rate. If the respiration is absent, then the score will be 0. If the respiration is somewhat less than normal, then the score will be 1. If the respiration is good, the baby is crying, yes, that is the symbol is a goodness. And next one is a muscle tone. The muscle tone is absent for the baby, then the score will be the 0. The muscle tone will be the somewhat little different, then the score will be 1. The muscle tone is active motion, the score will be the 2. And next one is reflection, in the sense mobility. So what the reflections will be the absent, the score will be the 0. If it is medium, if it that is a 1. And if it is extreme reflexes we are finding for the baby, the score will be the 2. And the color of the baby, if the color of the baby is blue, in the sense there is no oxygen percentages for the baby, in that case give the 0. And if the color is somewhat different, give the 1. If the color is complete pink color, that is a normal color of the baby, that absolutely the baby is normal. So this is how the categories of the baby, whether the baby is normal or abnormal after the delivery. So this is how the Upar score will be. And rest of the things, so clamping of the cord, as I told you, you must go for clamping exact position itself only. And next one is once the delivery of the baby is done, then you need to go for documenting of the urination and passage of the meconium. Meconium is called as the first passage of the stool after delivery is called as meconium passage. So that the date and time you must be note down, as well as urination of the passing of the you must go for wrote down. That meaning called as documentation. So that is you must go for it. And next one is administration of vitamin K. So vitamin K is an injection is using for the prevention of bleeding. So once the cutting of the cord, so once the bleeding is going to happen, so in that case prevention of this bleeding and all, you must administer of vitamin K for the mother. And next one is prophylactic eye care. You must clean the eyes to prevention of high infection. And next one is promoting parent and newborn bonding. As I told, soon of the delivery you must place the baby over the chest of the mother, and as well as you must observe the complete reflections of the baby once the deliveries occur. So that's about today's session, my dear students. Today I have discussed about what is the meaning of second stage of labor and what are the points to be noted as a nurse practitioner, medical practitioner, what exactly management will be done after the delivery, what is the immediate delivery care. So that I have discussed today. My dear students, so this is about today's session. I will come with next session, another topic. Until that, stay tuned. Thank you so much. Please like and share and subscribe. Thank you so much, my dear students.